Cyrus Wittig with you, and right now I am joined by Dr. Kaveh Asadi, a pediatric neurosurgeon with the Paley Orthopedic and Spine Institute, as well as the director of pediatric neurosurgery at St. Mary's Medical Center in West Palm Beach. Dr. Asadi specializes in brain disorders, including concussions. And Dr. Asadi, thank you so much for taking the time to visit with us tonight.
Yeah, thank you so much for having me, Cyrus. Great pleasure to be here.
Doctor, concussions are all over the news in the professional sports world, especially here in South Florida, with Miami Dolphins quarterback Tua Tagovailoa reportedly suffering 2 concussions in quick succession earlier this season. First of all, doctor, let's start with the simple stuff. What is a concussion, and what are the telltale signs and symptoms that you may have one?
That's a really, really good question to start off with here, Cyrus. So concussion, the definition is a type of traumatic brain injury. And so we try to grade the traumatic brain injuries from mild to moderate to severe. So concussion would technically fall into the milder form of TBI or traumatic brain injury. Now, having said that, the term mild, it's a little deceiving here. Honestly, everyone who has suffered a concussion or knows someone or has a family member or treated someone with a concussion knows there's honestly not much mild about it, or the effect is actually affecting, the way it's affecting the young athletes or athletes in general. It's can be pretty significant and affect their lives and their athletic, school, their family life so significantly that, again, the term mild is sometimes a little deceiving.
Right. Doctor, how long can the symptoms of a concussion, the subsequent impairment of a concussion, last an individual who suffered one?
It's one of those things, as you can imagine, is very different based on individual to individual. And it can be anywhere from, let's say, a day to 2 to a week to 2 weeks to several months. And believe it or not, even up to 6 months or a year later, some patients, almost 10 to 15%, can have symptoms a year later. And that's where it becomes very important to identify those athletes who have more prolonged symptoms and to try to be able to address those. And those symptoms, they can be anywhere from headaches to memory issues to problems with sleeping, school issues, dizziness. Again, it's a long list of problems kids, young athletes, or even professional athletes can experience that. It becomes really crucial to be able to identify it, but it's one of those things that is very individual, how long it takes the body to recover from that type of a brain injury.
Cyrus Wittig here on ESPN West Palm tonight, speaking with Dr. Kaveh Asadi, a pediatric neurosurgeon with the Paley Orthopedic and Spine Institute. Doctor, why is it so important that someone seek medical care or see a neurosurgeon like yourself after suffering a concussion?
Yeah, so that's very important. The medical care, I want to say more so than seeing a neurosurgeon. It's crucial to see a provider who is experienced in treating athletes with a concussion to identify, the symptoms, to be able to say when it's safe for them to return back to school, but also to initiate very, symptom or goal-directed therapies, which can vary quite significantly among athletes.
Dr. Asadi, just thinking back now to my own experience growing up and playing sports, there were always these rumors of what to do or what not to do when you think you may have had a concussion. And in this hypothetical, look, you take a big hit and you say to your parents or a coach, whoever, I think I might be concussed, but say you can't go to the doctor or you can't see a doctor or a neurosurgeon like yourself until the weekend. Say you get hit on a Friday and you can't see anybody until Monday. Are there any things that people should know about concussions, of what to do if they think they've suffered a head injury and they're kind of trying to do some self-care before coming in and seeing a professional?
So one of the big do's is to let someone know, either parents, coach, your teammates. It's and the younger the athletes are, the more conservative or careful we are letting them go back. And just sharing that. It doesn't mean it's has anything to do with a concussion or a brain injury, but if there's really any symptoms whatsoever, sharing that, obviously it's a huge, in order the self-reporting part, it's very helpful. But again, I wanna also emphasize that having an expert who is able on the team who's able to identify any potential signs of concussion is almost more important than the self-reporting. It's almost not fair to the young athletes. In the situation, it's very hard for them to come and say, "Hey, coach, this is
Right.
I'm not feeling good, or I have a headache," and they're just so used to. I mean, what they do with their bodies is so amazing that they just live with those little aches and little pains that they don't necessarily. They're not trained to coming forward and being upfront about it. That again, having experts. Or someone who's experienced, in identifying any potential signs is even more important than the self-reporting part. But if there are any symptoms, no matter who detects it, again, the key is to sit out. That's really what it comes down to. Sit out, to take some rest. There is no hard timeline if it's not 12 hours or 1 day or 2 days or so. And then see a doctor, the next possible opportunity the next day or 2 days later or whenever. And a good starting point for kids, obviously, is the team coach, the team doctor, if there is one, or the pediatrician's always a good starting point.
Again, Cyrus Wittig here with Dr. Kaveh Asadi, the director of pediatric neurosurgery at St. Mary's Medical Center. Doctor, we started this conversation by talking about Tua Tagovailoa, who said he does not remember being carted off the field during his injury against the Bengals. Is it common for concussions or head injuries to erase memories? And, how does that affect the brain? What is going on inside our skulls in the situations where we can literally have memories erased?
Yeah, so absolutely. The memory issues, it's relatively common. And there are different degrees of not being able to remember. One is in Tua's case, for instance, that I think the brain just does not store that the event and everything happened. It can that the time period can last for, let's say, 30 minutes. It can be more prolonged for several hours, 24 hours. In his case, I want to say it was it was a good stretch that he was not able to remember. And it's really the memory which is most commonly affected in concussions. It's new information, to be able to comprehend and retain new information. We see that in school age kids who out of the sudden go from being an A+ student, and now they're having a hard time remembering the simplest things, and which can be very frustrating and can cause a lot of downstream problems. But memory issues and those pathways of the brain which are responsible to store new information, it seems to be fairly sensitive to head injuries.
Doctor, the same week that the Green Bay Packers and the New York Giants squared off in London, there was a day-long summit where medical leaders from the NFL and the English Premier League discussed data and practices pertaining to mental wellness, injury reduction, concussion, and head impacts. Do you find this type of concussion outreach encouraging, and do you think it will lead to more concussion evaluation and hopefully solutions?
Absolutely. So I think that was a really nice move by the NFL together with the Players Association. They showed a real concern, real time response to again the back-to-back concussions Tua suffered. And as a result of that, I mean, it's some people refer to it now as the Tua rule, that they did update the NFL guidelines in real time. And one of the major changes there is that ataxia or unstable gait is one of the no-go symptoms, meaning the second a player is showing or experiencing those symptoms, they're automatically removed and they cannot return back to play until, for sure not for that game, until there is a formal evaluation.
Again, Cyrus Wittig here with Dr. Kaveh Asadi on ESPN West Palm tonight. Doctor, when we think of sports where concussions are the most prevalent, football, certainly one of them, ice hockey, rugby, what other sports show high rates of concussions? And what are those that we might not think about that show abnormally high rates of concussions?
It's a little different depending on male or female athletes. And boys, as you mentioned, really football, hockey, rugby being another big one. When we look at the overall concussion risk, In girls, believe it or not, really soccer is the number one offender for a concussion, followed by lacrosse and basketball. Soccer, I mean, it causes obviously concussion in boys too, but it's not as prevalent compared to those other sports.
Doctor, besides concussions, what are your other specialties when it comes to pediatric neurosurgery care?
The things actually I specialize in, it's minimally invasive approaches or surgeries to the brain or to the spine and the spinal cord, and really any diseases which might require surgical intervention as far as, again, helping kids with, brain disorders or disorders affecting the spine, spinal cord, or spinal nerves.
Doctor, what's the age range of the patients that you see?
So I see anything from before the babies are born, like prenatal consultation, to young 20s and even sometimes older, depending on the diseases. And there are certain things where technically grown-ups can have, but they fall more into the expertise of us pediatric providers. So there is no clear age cutoff. I want to say the vast majority is in up to 18, 20.
Wrapping things up here with Dr. Kaveh Asadi. Doctor, before I let you go, I want to ask about something that we were chatting about before you came on the air, which is a conference taking place in Amsterdam where doctors from all around the world get together and discuss and share their recent findings when it comes to head injuries and concussions and things of that nature. And then in turn, once they compile the data, share their results, a lot of the guidelines that we use here in America and internationally affecting so much of our sports, are changed because of what is shared and the information that is exchanged at these conferences. Could you tell us just a little bit more about really the big event in the world of concussions and head injuries that is taking place this weekend?
Yeah. So it's usually about every 4 years that all the experts in the field, internationally from all the major sports league associations, medical associations, they meet. The last one was in '96 in Berlin, and the subsequent was supposed to be in 2000 in Amsterdam, but because of the COVID pandemic, it was postponed, and it's actually happening this week. It's the 27th, 28th that, again, all those experts meet, and they come up with a consensus agreement what the state of the art of concussion treatment should look like. And then I want to say all the national sports recommendations, the CDC guidelines, really focus on those recommendations. And then it takes a little while, but then usually those recommendations get implemented.
Last thing, Doctor, I would just love for you to share with our listeners and tell us a little bit more about the Paley Orthopedic and Spine Institute at St. Mary's Medical Center.
Yeah, Paley Institute is a very unique institute where there are providers who are absolute world-class experts in their field, and we strive to provide the best-in-class care when it comes to adult but also pediatric team. I obviously being a pediatric provider caring for kids, I work a lot with my pediatric orthopedic counterparts like Dr. Feldman, Dr. Dobbs, and Huger, Dr. Shuffleberger, and Dr. Claire Shannon, Dr. Miller, and obviously Dr. Paley himself. But again, the key is that we work as a team among different specialties, again, to achieve that best-in-class care where we really strive towards the best possible outcomes.
Doctor, thank you so much for the time and, of course, all of the knowledge. Already looking forward to our next visit.
Great. Thank you so much for having me.
For more information on Dr. Asadi, visit PaleyInstitute.org. That is PALEY Institute.org, or call 561-844-5255. Thanks again to Dr. Asadi. More on the other side. This is ESPN West Palm Tonight.